A very good afternoon to you all, and a very warm welcome to the SRUK Virtual Conference 2021. Thank you very much indeed for your support. A very warm welcome to this breakout session, Face Facts, with our expert speaker, Dr. Elizabeth Price. And we do hope you've taken the time to connect with others in our community and enjoy the exhibitions and and the wonderful sessions that have taken place. So my name's Ollie and I work for SRUK. We'll be hosting the session this afternoon. Can I just remind you just to, if you could mute and turn your cameras off, that'd be much appreciated. And we also ask that you don't record, screenshot or take photographs of the sessions. The session will be recorded. You will, of course, have the opportunity to ask Dr. Price questions. So if you could please submit your questions via the chat function during during Dr. Price's presentation, and then your questions will be asked at the end of Dr. Price's presentation. And for any questions that are unanswered, we will certainly do our best to collate your questions and to ensure you receive a spot response within a reasonable time frame. So very pleased that Dr. Elizabeth Price has joined us this afternoon. Dr. Price is a consultant rheumatologist at Great Western Hospital in Swindon. And in addition to general rheumatology, Dr. Price has a specialist interest in Sjogren's syndrome and runs the multidisciplinary Sjogren's syndrome accepting tertiary referrals. She's also a member of the steering committee for the UK Primaries Sjogren's Syndrome Register, and she is currently medical president of the British Sjogren's Syndrome Association. So it gives me great pleasure to introduce you to our guest speaker for this afternoon, Dr. Elizabeth Price.
Thanks very much, everyone, and thanks for joining us this afternoon. I'm going to try and share my screen. This is the bit that always gives me a little bit of heebie-jeebies, so make sure this works. Good, so you should be able to see the first slide, and I'm going to talk you through, I was given the topic face facts. As Ollie's highlighted, I'm actually a specialist in Sjogren's, and so my big interest is dry mouth, but I'll talk about things in general, run you through some advice, and then answer, I hope, some of your questions at the end. So if I get this to move. Yes, good. Okay, so what are we going to have a little chat about today? So, and what issues do patients with scleroderma get? Well, the first thing you get, or can get, is microstomia, which is a very fancy medical way of saying a small mouth. Xerostomia, again, another fancy medical way of saying a dry mouth. And you can get something called telangiectasia, which are the little dilated blood vessels that you can see under the skin, sometimes on the face, but often elsewhere on the body. The consequence of having a dry mouth is increased dental decay and gum disease. And that's a big interest of mine because I think a lot of what we see is preventable with the right care. And I fully acknowledge it's difficult. You've got a small mouth for your dentist to get into it. And in fact, some of our patients are actually picked up first by their dentist rather than their GP because the dentist comments on their small mouth and the difficulty giving them dental care. So what are the consequences of microstomia and how do we pick it up? So you'll have a reduced mouth opening. Now, a simple way of testing mouth opening is to take 3 middle fingers, put them sideways on and see if you can get them inside your mouth. And the reason we do that is because your fingers will be proportionate to the size of you. So obviously we're all different sizes, different shapes and sizes, but you should be able to get 3 fingers in that way around. And what we find in patients with scleroderma is that over time, that wideness reduces over time. And the consequence of that is it's difficult for dental care and it's very difficult for you to clean your teeth properly. You'll also notice that a lot of patients with scleroderma develop thinning of the lips over time, almost as if their lips are disappearing a little bit. And what can you do about those consequences of scleroderma? Those of you who've got it will know that it's a disease which we've struggled with in rheumatology in terms of management and drugs. And things are improving. There's lots of very good research going on, and I'm sure you've heard about some of that today, but we still don't have any curative treatment for scleroderma as things stand at the moment. And all of our treatments are aimed at conserving what you've got and stopping it getting worse. What can you do? Because there's a lot that you can do to help yourself. in terms of your mouth opening and your facial skin. It's vitally important you moisturize regularly. Ladies, in my experience, are better than that than men, but nonetheless, we probably all need to moisturize more. You do need to be careful about sun exposure. One of the most damaging things we do is take ourselves out into sunshine, and that breaks down collagen. And I suspect very few of you still smoke, because smoking also has a detrimental effect on collagen. And that's something that you can do yourself to help. There's some research looking into facial exercises. You can download some quite nice little videos. I had a look at them when I was preparing this talk on YouTube, showing you the sort of exercises you do to stretch your mouth and to improve the opening and the suppleness of the skin around your mouth. I'm sure you'll want to know, do they work? And actually, there have been studies looking at patients being put into a study where they're randomized to receive supervised exercise or not, and what happens. And what these studies show is that the exercises work as long as you continue to do them. And in the studies, when they had a group having supervised exercise compared to a group that didn't, at the end of the study, and typically a study will last about 12 weeks, 3 months, and the patients who had stuck to the exercises and stayed in the study had done better in terms of suppleness and mouth opening. But when they went back 6 months later and followed up the group, they found that most people had drifted back to the normal, or back to the mean, and there wasn't such a huge advantage. And the bottom line is that these exercises work if you continue to do them, and it's very difficult to sustain that in the long term. But it's certainly worth looking them up, and if you can motivate yourself to do them on a regular basis, they may well help. I'm not going to talk about some of the fancier techniques that are available to improve mouth opening and lip size, and I know that there is research looking at surgery, including fat transfers and fillers. My reading of the literature is that this is still very much experimental. It's not routinely offered. I know that the Royal Free had a few people looking at it and experimenting on it and so forth, but the solid results, if you like, the long-term solid results are not there yet. So I think you have to watch and wait and see what happens in terms of surgical intervention for mouth opening. But the most important thing I think about scleroderma in terms of your dental health is the effect of a dry mouth. And don't underestimate how damaging a dry mouth can be to your teeth. So a normal individual, someone like myself, will produce well over 1 litre of saliva a day, which we constantly produce and we swallow. And if you look at production rates of saliva, they're naturally best in the morning, and then they tail off later in the day and overnight, and they're at their lowest overnight. But there's little peaks and troughs during the day. And what we know is that if you chew or eat, that will stimulate what we call the major saliva glands. And we've all got 6 major glands, 2 in our cheeks, 2 under our chin, and 2 under our tongue. The parotids, the submandibulars, and the sublinguals. But on top of that, we've got about 600 or more minor or baby saliva glands lining the whole of the inside of the mouth and the oral cavity. And when you're just sitting down doing not very much or watching TV and so forth, it's the minor saliva glands that are producing background saliva. But the minute you start to chew, the major glands, the parotids in particular, come into play and start producing saliva. So one way of stimulating saliva if you've got the dry mouth is to chew. And we often recommend that patients chew sugar-free chewing gum, as that will help. Saliva itself isn't just water. It's really important to understand that it contains all sorts of goodies: bicarbonate, which is an alkalizing agent, and phosphate, and other minerals, including calcium and fluoride. And one of the most important things that your saliva does is it maintains the pH, the acidity and alkalinity balance in your mouth. Now, most things that we eat, particularly if they're sweet or fruity, are acidic. And acid is really bad for dental enamel. It strips that shiny surface off the teeth and exposes the softer dentine underneath, and it can cause dental decay. In most people, you eat something sweet or sugary, and that stimulates your saliva, and the saliva comes into your mouth and neutralizes that effect. Unfortunately, if you've got a dry mouth, that doesn't happen to the same extent. And just to bear in mind that a lot of people are drier than they appreciate they are, in that you're not actually aware of a dry mouth until you've lost about 70% of that 1.5 litres per day. So you have to be quite low down before you actually become aware of it, because we've got such a huge reserve. And if your mouth becomes acidic, which it will do if you're not producing good quantities of saliva, you can get accelerated dental decay because you get enamel damage. So the saliva is very important for that. And there is very good evidence that if you keep your teeth in a neutral environment over time, they don't lose mineral and you get better dental protection over time. So it's not just about looking after your teeth in terms of brushing them, it's in terms of the acid attack on your teeth. And the other thing to say about teeth is that teeth can withstand acid attacks maybe 3 times a day. So we eat 3 times a day and that's fine. But if you're a snacker or a nibbler and you're constantly having something through the day, particularly if you're having something like a boiled sweet with a fruity or acidic flavour like lemon, that will actually cause more damage than having 3 decent meals a day. So being a snacker is not good for a dry mouth patient. And we've talked a lot about the dental decay, but it's important to remember that as well as that, you need saliva to help you swallow. So lots of people with a dry mouth will struggle with choking. And of course, in scleroderma, you've then got the battle as well that you often have esophageal problems as well. So the esophagus, which is the food gullet, if you like, that joins your mouth down to your stomach in a patient with scleroderma often doesn't work so well. So in a normal person, you've got this constant muscular contraction that's called peristalsis, which coaches, if you like, sort of gets the food down, and that doesn't happen so efficiently in patients with scleroderma. So it's important that you drink with your food to make sure that you push or you encourage the food down your throat. You chew it carefully to help break it down. And just to bear in mind that, again, saliva in a normal person will contain enzymes that start breaking down your food. And if you haven't got that, you may have problems breaking down your food. So vitally important that you do chew properly. And think about the consistency of your food. Think about avoiding things that are too harsh. You might struggle with some harder foods, and take care with the spicing in foods as well and the temperature of the food that you eat. Hot food can numb the inside of the mouth and make you less sensitive, and that can cause problems over time. And I've talked about losing your teeth, but even more importantly is the gums. So your gums, which hold the teeth in place, are very important. And you can get gum disease in a dry mouth situation because there are certain bugs in your mouth, particular one called Streptococcus mutans, which can collect in the little crevice between your teeth and your gum and cause gum disease, which can loosen the teeth. And you can lose even good teeth because of that if you're not careful. Well, there's some pictures here. So the one on the left is an individual who's starting to get gum disease and gum recession. So you can see that you're exposing between the shiny, hard enamel and the gum. Can you see that softer, yellower dentine? And that's much more vulnerable to decay and damage than the harder enamel. And on this side here, on the right-hand side, this is a person who's getting little holes in their teeth, and where the acid damage from acidic foods has destroyed the enamel and is allowing decay in. A healthy mouth contains lots of bacteria. So it's a bit like our gut. Our guts contain lots of good bacteria, which balance out the bad bacteria. And one of the consequences, for instance, of having a course of antibiotics is that it kills off the bacteria in a very non-discriminatory way. And that allows the bad bacteria to overgrow, and you can get bacterial overgrowth. And the same thing happens in your mouth as can happen in the stomach. And there are good ones and bad ones. The one that we worry about the most probably in the mouth is Streptococcus. The two we worry about is Streptococcus mutans, which causes gum disease, and then Candida or thrush. And that can be really troublesome if you've got a dry mouth. And there's 2 pictures here. The picture on the left shows you a simple thrush infection, which is white flaky patches that you can actually sometimes pick off inside the mouth. And that normally responds pretty well to treatment with things like nystatin, which is a liquid or a cream or a gel even that you pop in your mouth. The right-hand one is a bit more tricky. So that's what we call complex thrush, and that's a deep-seated thrush or candidal infection. And that's caused redness and erythema. So you can see that the white patches have disappeared. And sometimes that's missed as being thrush because it doesn't look like classical thrush, but it still is caused by the same bug. And that would need a course probably of fluconazole, of an oral agent to get rid of thrush. And the other thing that you do sometimes see in scleroderma is that thrush can extend down the esophagus, and that can cause discomfort and increase the problems you're having eating. So really important you look after your mouth and don't get thrush in the first place. And the best way to avoid thrush is to have good bacteria. So eat live yogurt on a regular basis, clean your teeth very carefully, and avoid too much sweet stuff. So when you're cleaning your teeth, it's really important that you do that really carefully and correctly. You should be using, I think, I prefer electric toothbrushes. You might want to take the advice of your hygienist or dentist. The bottom line is that a manual toothbrush is good if you use it correctly. But I know that a lot of you will have problems with arthritis in your wrists and hands and poor grip. And in that situation, an electric toothbrush is much easier to use. It's also got a much smaller head, so it's easier if you've got reduced mouth opening to get into the back and into the crevices and so forth. And the other massive advantage of an electric toothbrush is it reminds us to brush our teeth for long enough. So you should brush your teeth for at least 2 minutes, morning and evening. You should use a dry toothbrush, put the paste onto the dry toothbrush, and then concentrate on brushing each tooth and work your way around. And these electric toothbrushes have come down tremendously in price over the years. And even I've got a very simple one, which beeps at me every 30 seconds. So it's 30 seconds for the top, 30 seconds for the top, and so forth, so that you don't forget to rotate around your mouth. The other thing to be aware of is that just brushing your teeth with an ordinary toothbrush will miss up to 40% of the tooth surface, because in between your teeth, you just don't get the brush in, and you do need to use an interdental product. And you can either get these little interdental brushes, there's lots of different ones on the market. A lot of the supermarkets make their own makes now, and Wrigley's do Wrigley's Interdental, which are like little soft plastic sticks. So if you've got very tight teeth or very sensitive gums, that can sometimes be a little bit kinder than using these brushes. You can use floss, although again that needs quite a bit of dexterity to use floss, and some people use little picks and so forth. And if you do get gum disease, so if you've got inflamed gums, your dentist may well recommend some chlorhexidine or Corsadil. Now that's great, it's very good for gum disease, but unfortunately if you're not careful, Corsadil can stain your teeth a sort of brownish colour. So Curacept is a newer version of Corsadil, which you can buy in a good chemist. And that has the effect of Corsadil, but without the staining. So it's quite a useful little trick to know. If you do use Corsadil and get staining, your dentist can remove it when they're scaling and polishing you. And it is worth getting to know your dentist and your hygienist very well. So chlorhexidine, that's the stuff I was talking about. And it's bactericidal, which means it breaks down the cell wall of the bacteria that causes gum disease and gets rid of them. It does stain. And the other thing to be aware of is that when you use chlorhexidine and toothpaste, they don't combine very well together. And it's a bit the same problem you get if you brush your teeth after drinking orange juice. You should be aware that drinking something acidic can soften the enamel, and if you then brush your teeth on top of that, you can actually damage the enamel. So try and leave a good 20 minutes between food and brushing, or brush before you eat, ideally. Fluoride is really important. I've become a bit of an obsessive about reading the packets of the toothpastes nowadays, and there's a couple of things to be aware of. So you need to choose a toothpaste that has got fluoride in and has at least 1,000 parts per million of fluoride. Now, your dentist can actually prescribe even higher ones, 2.5 and 5,000, if they think your teeth need it. But a good rule of thumb is to always go for at least 1,000. And the fluoride is really important because it binds to the calcium and helps repair the enamel. And when you brush your teeth, particularly when you brush your teeth in the evening before you go to bed, don't rinse the fluoride toothpaste off. Brush your teeth, spit out, but try and leave as much fluoride stuck onto your teeth as you possibly can, because that will help rebuild the enamel and strengthen the outside of the teeth overnight. And I've already mentioned about avoiding orange juice and toothpaste together, because that can damage your teeth. Another little tip on fluoride and toothpaste in general is to consider one that has a toothpaste that hasn't got sodium lauryl sulfate in it. So SLS is the abbreviation that tends to be used on the packets. So sodium lauryl sulfate, or SLS, is a foaming agent, and it makes your toothpaste frothy and froth up in your mouth. Now, it's a little bit like shampoo. You don't need the froth. That's there really to make us feel like we're brushing our teeth really well. And actually, SLS can cause mouth mouth ulcers and can be quite harsh if you've got a very sensitive mouth. So if you're struggling with mouth ulcers, your mouth is very sore, consider switching to an SLS-free toothpaste. Now, both Sensodyne and Colgate make SLS-free versions of their toothpaste. You just need to read the packet carefully when you're buying it in Boots and or wherever you go to get your toothpaste. And it usually will say on it, it's SLS-free. Don't expect it to froth up, but actually you don't need the froth. That's a picture there in the middle of the Durafat, the very high fluoride toothpaste that dentists can prescribe, and at the bottom Sensodyne, which is a good make and which they do as SLS-free version. The other thing to point out is that there's something called Recalident, which is available this is the commercially available one, GC Tooth Mousse, and that is a almost like a re-enameling agent for your mouth. So if you're getting enamel loss, consider getting yourself some of this stuff and painting it on your teeth at night. The other thing that can be worth asking is asking your dentist, would they consider a fluoride varnish for you? And that's where they put an extra layer of fluoride onto the teeth as a treatment to try and harden up the enamel and prevent further deterioration. Generally worth considering and worth having a chat with them about. Another little tip for the mouth, a little top tip for the mouth, is to use bicarbonate. This is just fancy, this is not fancy bicarbonate, this is the stuff that you put into brownies and cakes and so forth. And bicarbonate is a really good old-fashioned treatment because it's very alkaline, so it's good at reducing the acidity in your mouth. And you can put a pinch in your drinking water, so if you have a bottle of water, just putting a little pinch in will actually just take the pH down to alkaline and will protect your teeth. But you can also make a lovely homemade mouthwash, which is just a teaspoon of bicarb and half a teaspoon of salt in a pint of water that you've boiled. Mix it all together, let it cool down to sort of tepid temperature and use that as a mouthwash through the day. It's very refreshing. Don't use it immediately after brushing because you don't want to wash off the fluoride. But if, say, for instance, you brush carefully in the morning and then you have a lunch, it's a good one to swill and spit with after lunch to get all the bits and pieces out of your mouth, or if your mouth is feeling dry and in need of a top up in between. The other thing you can do is that you can dab your, and just pour a spoonful of bicarbonate onto a saucer and just dab your toothbrush, a slightly damp toothbrush onto that before you brush your teeth, just to get some bicarb into the toothpaste itself. And in fact, you can buy some commercial toothpaste, Arm & Hammer, that's already got bicarb added. And that's, again, very good for your teeth. I wanted to mention xylitol. So xylitol is a sweetener, and you can buy it in packets actually in the sugar aisle of the supermarket. But as well as being good because it means you can take sugar out of your diet, and obviously sugar is not good for your teeth, it has a specific action against the Streptococcus mutans. And you remember from a few slides ago that that's the bug that causes gum disease. And xylitol actively inhibits Streptococcus mutans, so it actually helps protect you against gum disease, and it's safe if you're diabetic. And you can get it, as I say, you can just use it as a complete sugar substitute. You can get it in the form of Xylomelts. A lot of my patients have started using these. These are little pastels you can buy over the counter in places like Boots and Superdrug. They stick them between your gum and your cheek, and they slow release moisture into your mouth, but they also inhibit the bugs that cause dental decay. And you can get sugar-free chewing gum that contains xylitol, so always look out for that. Just be aware, if you do keep dogs, that it's very toxic to dogs, so don't let your dog get at it if you have a dog at home. And then there's a couple of other things that you can do. So we've already mentioned Xylomelts, but I use a lot of a drug called pilocarpine. Pilocarpine, the commercial name is Salogen. It's a very, very old-fashioned drug, and it works by stimulating secretory glands. Now, all the secretory glands in our body have little M receptors, M for mummy receptors on them, and pilocarpine interacts with those receptors and gives the glands a bit of a kick. It works in most patients. It works regardless of the gland, so it should improve your saliva flow. It might also improve your tears. The drawback is it can make you a bit sweaty because it stimulates your sweat glands. I think it's worth a go. Lots of my patients do use it. It comes as a little 5 milligram tablet, and the trick with it is to start with a very low dose and build it up just to get yourself used to it. So, and always take it with food and a glass of water. So I usually recommend that patients start with 1 tablet in the morning, and then do that for a week or two. And if they're tolerating it, add a second one at lunchtime, and then eventually one in the evening as well. If you can't manage even the 5 milligram dose, there is a little trick where you can get your doctor to prescribe you the eye drops, not to put in your eyes, but to actually take under your tongue. And that allows you to deliver a tiny little dose rather than the 5 milligram dose, because that's the smallest dose that they actually produce commercially. And then the only drawback to this is you have to get your GP involved, because it is a prescription-only drug. And then some of my patients have actually tried something called a SaliPen. That's a picture of it there. It's a little handheld device, and it works on the principle of acupuncture. So there are studies showing that acupuncture improves salivary flow rates. But of course, you can't walk around with little acupuncture needles in your glands. So this is a commercially produced little handheld device. It's battery operated, and you can see it's got 2 little prongs on it, and those little prongs go under your tongue, and you switch it on, and it gives it a tiny little tingle, a little kind of buzz, and it stimulates your salivary glands. Now, patients report that it does help. It doesn't work in everybody. The drawback is that you have to buy them, and they are expensive. I think they're around about the £150 mark, but you might want to look into it if you're really interested. I think that's what I was going to say about dryness. I was just going to mention telangiectasia, which are the little blood vessels, small, tiny dilated blood vessels, which can occur on the face and on the body. They can occur naturally in some people. They're also associated with things like liver disease in some people, and they can actually occur in women on the pill as well. So there's a hormone drive with them. They're not unique to scleroderma at all. So don't, if you haven't got a diagnosis of scleroderma, but you've got a few telangiectasia, don't jump to conclusions. Just check out with your doctor. There is unfortunately no really good treatment for these, I'm afraid, and some ladies do use camouflage makeup on them. And I just wanted to finish off by talking about lifestyle a little bit. So I think there's a lot that you can do to help yourselves. We know that patients who stay positive do better in the long term. I know that fatigue is a big problem in most of the rheumatic diseases. I deal with Sjögren's predominantly, and they get a lot of fatigue. But I know scleroderma also is also associated with fatigue. And unfortunately, most of the drugs that we've tried for this have really been very disappointing. But there is very good evidence that mindfulness helps by maintaining a positive attitude and helping you make the most of life. There's also good evidence that exercise helps, and we should all be exercising. I know it's hard to fit it in when you've got a busy life, but actually we should all be looking to do 30 minutes of exercise a day, just sufficient to get our heart rate up, but still able to speak in full sentences. That's the sort of guide that we use. So for most people, that would be a brisk walk, swinging your arms, and you can start low and build up. But if you can build up to 30 minutes a day, that would be hugely beneficial for you in the longer term. Bed rest isn't good for us. We've been very aware of this during the pandemic. We've seen a lot of people ill and in bed and so forth. And the studies are demonstrating that patients who lie in bed in hospitals lose 2% of their muscle mass per day. So unfortunately, all that muscle you've worked hard to build up can disappear very quickly if you have any enforced bed rest. And those of you who've been through surgery and so forth will know how hard it is to get going afterwards. Very important to think about your diet. I'm always very keen on people eating properly meal times and not snacking because of the effects on their teeth. Very important that you include omega-3 in your diet. Omega-3 is in fish oils, salmon, for instance, and there are vegetarian, commercially available vegetarian alternatives. And then calcium, vitamin D, vitally important for your bones. And vitamin D is a really interesting vitamin with lots of evidence that it isn't just about bones, it's also about things like muscle strength and mood as well. And some evidence, in fact, that the vitamin D deficient patients can get a little bit of seasonal affective disorder. Quite terrifying, really. We know that 30% of the UK population are vitamin D deficient in the winter months. So really important that you make sure you either get a little bit of sunshine for your vitamin D or some vitamin D supplementation. And if you take fish oils, of course, they contain vitamin D, so you can get your omega-3 and your vitamin D in one place. And sleep, good quality sleep is important. Some of you will have been through sleep hygiene programs where you're taught about having set bedtimes and get up times and trying to get yourself good quality sleep. And so just my take-home messages before we move on to the questions are moisturising your skin at least twice daily, look after your teeth. You know, it is really important. People with dry mouths do not tolerate dentures, and because you just haven't got the moisture to hold a denture in. So it's really important you maintain your teeth as much as you can. Do get a good relationship going with your dentist or hygienist. I know it's been particularly difficult during the pandemic. Clean your teeth carefully twice a day. Try and avoid eating between meals. Stay fit and healthy. And if you are interested in more advice on dryness and some of the topics I've talked about today, the BSSA do have a website, which the link is there. They also run a helpline. They're very happy to take calls from people needing a bit of advice and support. So I think that's my last slide. Yeah, thank you very much for listening. And I'm going to stop sharing the slides, and I think Ollie's going to feed me a few of your questions. Ollie's still muted.
Thank you very much indeed, Dr. Price, for that wonderful and very informative presentation. It was excellent. And yes, and thank you very much to our attendees for submitting excellent questions. So I'm just going to start off with a question from Linda that's come in, and Linda asks, is it normal to have excessive saliva during the day, resulting in dribbling and spitting when talking, and an excessive dryness at night?
Oh dear, so that's a real problem, isn't it? So unfortunately, the excessive dryness at night is a real problem, because that's not going to be good for your teeth. So your teeth will suffer overnight because you're dry. I just wonder if you're dribbling during the day and dry at night, have you not got good mouth closure? Because I mean, I know a lot of us sleep with our mouth open, particularly if we lie on our backs, our mouth's open, but there's no doubt that if you've got your mouth open at night, that dries you out even more. And if you've got poor mouth closure during the day, you may be dribbling because of that. And I wonder if your body's overcompensating, and that's causing some of the excess saliva during the day. And there are a few drugs that can make you drool and dribble as well. So it may just be worth just sitting down with your doctor or your specialist, or even your specialist nurse, maybe running through your drugs, making sure there's nothing there that's exacerbating it. Asking your dentist about mouth closure. Are you getting good mouth closure? Have you got problems that mean you're not closing properly? It's a bit like if you don't close your eyes properly, you can get a similar problem.
Thank you. Thanks, Dr. Price, for that excellent response. And thank you, Linda, for your question. A question from Tanya. Tanya asks, I have found the 3-finger test very interesting. I can just about do it, which I suspect indicates that my mouth opening is small. Mm-hmm. Would you advise that we do the mouth exercises preventatively, or only when we get the real symptoms?
No, so the evidence is that they do work if you do them. So, and of course, if you look at everything we do in rheumatology, it's all about preventing damage. So what we know in the rheumatic diseases is that in the early stages, you've got the inflammation, then you develop the damage. And once you've got damage, we can't go backwards. So I would suggest, if you think you're starting to get reduced mouth opening now, start doing the exercises now. The difficulty you'll have is staying motivated, but it may be that one motivation would be it's not getting worse. So if you can measure your mouth yourself, in fact, in these studies, they use all these fancy centimeters and so forth. But the trouble is that, you know, how accurate is that? And given, you know, the 3-finger test is a very easy thing to do. You can do it yourself, and it gives you an idea of how you're progressing. So I would say start them now. There's lots of funny little YouTube videos which show you how to do it.
Thank you, Dr. Price, for that excellent question, and I hope that answers your question, Tanya. A question from Helen. Helen asks, some of my teeth are becoming loose. Is there anything I can do to stop it? I have regular dental appointments and floss every day.
Oh gosh, you poor thing. So you're doing what you can. Speak to your dentist about whether you've got a bit of gum recession and whether there's any benefit in having any particular treatments. Speak to your dentist about fluoride varnishes. Think about the xylitol if you're not already doing that. If you're flossing and you're still getting problems with interdental cleaning and so forth, I've got a few patients who switch to a water pick and find that better and a little bit gentler. It sounds like you're doing everything you can, though, to be honest. And as I say, I'd have a chat with your dentist. A water pick's beautiful if you struggle with flossing or flossing isn't enough, because it's like a high pressure jet, a bit like when you go to the dentist yourself. And you can get them now, again, in places like Boots or Amazon and whatnot. And I think the price has come down considerably, so worth thinking about.
Thank you. Thank you, Dr. Price. A question from Imelda. My teeth are extremely sensitive. I was given Durafat toothpaste, but my dentist, when I lived in Ireland, but now that I'm in the UK, my dentist is refusing to give it to me. I have Raynaud's, fibromyalgia, and vasculitis.
Okay, so Durafat has to come on prescription, unfortunately, and that's because it is very high fluoride. But so it's interesting. I went to a talk given by a dentist about fluoride and so forth, and actually she herself used didn't use Durafat. She used one of the over-the-counter Colgate ones, and you can buy some of the lower strengths, not the 5,000, but some of the lower strength ones over the counter, and there's not a huge difference. It's all to do with the fact that you're using it. So, and I would personally look for, there's a really good Colgate toothpaste that's got high fluoride and no SLS, and that's probably the best compromise. It's a difficult one, this prescription business, because the GPs are being told that these drugs are no longer mandatory for them to prescribe. They're discretionary products. But you might want to have a chat with your GP and see whether they will prescribe it. But it is difficult. I could accept that.
Thank you, Dr. Price. This is a dry mouth related question from James. So James asks, I found out a few years ago I had a dry mouth from my dentist. I have lost some teeth, and the surgeon often gets concerned because I hardly bleed. Why is this? Also, how can I have dry mouth yet suffer with dribbling?
Yes. Yeah, so you're not, so it's interesting. We see the same thing in the eyes, actually, in that patients with dry eyes often complain of watering, which just seems completely paradoxical, but it is to do with the quality probably and the inappropriateness. So I suspect your baseline saliva secretion is down, and then your body tries to overcompensate and produces the excess. It's again probably due to the mouth closure, not getting good closure. The lack of bleeding might be a similar thing to Raynaud's, poor blood supply to the gums, which would explain why, because we had a lady earlier was saying that she's got loosening of her teeth, and it may be that the blood supply to the gums is down as well, a bit like the blood supply to the fingers is poor, and you get poor healing in the fingers. So I suspect it's part of the underlying scleroderma. There is, as you know, no good cure for all of this, but looking after your teeth really will help long term.
Thank you, Dr. Price. Anita asks, is it normal for scleroderma limited patients to get very painful in the mouth jaw area, even though dentists said the teeth are good?
So you can get something called trigeminal neuralgia. I wonder if she's got that. So you can get these nasty lancinating pains, and the trigeminal nerve sits back here around about behind your ear, and it's got 3 branches, a top one, a middle one, and a bottom one. And some people get trigeminal neuralgia. I see that quite a lot in Sjögren's, so I imagine it's quite common in scleroderma as well. And it's a neuralgic pain, a very unpleasant pain. So that's worth thinking about. If you have got trigeminal neuralgia, and if you've looked it up and think, oh, maybe that is what I've got, unfortunately, conventional painkillers don't do an awful lot for it, but it can sometimes respond to some of these slightly unusual drugs like amitriptyline and gabapentin and so forth. So I think it might be, someone's asking me to spell a word. They're asking me to spell trigeminal neuralgia. TRIGEMINAL, and then neuralgia, NEURALGIA. Yeah. Okay,
excellent. Thank you very much for that.
That's right.
Question from Jennifer. Jennifer asks, I have thrush from the medication I'm on, and nothing yet works. Have now been referred back to the hospital.
So resistant thrush is a real problem, and resistant thrush is difficult because you need to eradicate it and keep it eradicated. So if you've got difficult thrush, probably the things like the nystatin and dactarin aren't going to be enough. And what you'll need is a 10 or 14-day course of fluconazole, which is an oral anti-thrush agent, which has to be prescribed. And then the important things to remember about thrush is that if you constantly take a drug, then you'll constantly get thrush and you'll develop resistant bugs. So what you need to do is take your fluconazole course, and there are a few others available, had that already said. So it's itraconazole. You need to speak to your dentist about, your doctor about all the different ones. The problems with some of these is that some of these drugs can upset your liver. So you have to be very careful. So itraconazole is an antifungal that can upset your liver. So you need to have a supervised course normally, and then you need to have a break and then something different. So I see people with resistant oral thrush, and what we say to them is have like, a 10-day course of nystatin or Dactarin, then a 3-week break, then another 10-day course of something else, and so forth, and cycle. It's a bit like the patients who get bacterial overgrowth in their gut. You have to keep changing the antibiotic to get on top of it. So that's the way you treat it, is with cyclical treatment. And I know 1 or 2 people who say that you should have something like a 10-day course every 8 weeks or something, so that they just try and keep on top of thrush. But it's probably cyclical. That's probably what you need. And sometimes you can swab it and look for sensitivities. That's the other thing to think about. But complex.
Yeah, thank you very much indeed, Dr. Price, for that excellent and very thorough response.